Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, everybody? Christian Brindle here. Welcome back to the number one Medicare podcast in the country. This is episode 276. I'm your host, Christian Brindle. It's my job to provide you with Medicare education so that way you can make a more informed decision when it comes to selecting your Medicare choices. Now, if any of you have been listening for quite some time, granted, remember, this show was started in 2018, 2019, somewhere in that time frame. We've been off a while. And I apologize about that. It's not easy when you're running a business to continuously stick to the show schedule. But that being said, it's been almost a year since we brought you an episode, and for that I apologize. However, I found that the best time to bring you new information and information on changes going on in the Medicare world going in to 2024 at the time of recording this episode is when we're approaching the annual election period. If this is your first time listening, if you are a first-time listener, as they like to call them, again, my name is Christian Brindle. I run an agency called Brindle Insurance Services located just outside of Sandy, Utah. And we specialize in Medicare health plans. We're an independent agency. We work with a multitude of different insurance companies to help you find your best option based on your needs and your preferences. This show is 100% educational. And our intention always is to provide you with the real straight information, no fluff, no propaganda, no biases towards one type of plan or another type of plan. We are strictly here to provide you with educational, true information on anything you can potentially be looking at, so that way you can make your best decision with the information that we give you. And if you like the information we give you and you do want to work with us, perhaps maybe you can reach out to us and we can help you with your plan, but there's never an obligation to do so. My office, again, is located in Sandy, Utah. Our office number is 801-255-5340. Again, 801-255-5340. And one of our licensed, qualified, friendly, smart, talented agents can help you with your Medicare plan. Okay? Today's topic we're going to talk about is why I believe that the government is pushing you as seniors and you as Medicare beneficiaries into Medicare Advantage. And I believe the writing is on the wall. I think the writing's been on the wall for quite some time. This might come across to some of you that I am saying that Medicare Supplement or Medigap is not a good product anymore. And that's not what I'm saying. I think the Medicare Supplement or the Medigap is a fantastic product. I think both Medicare Advantage and Medicare Supplement plans have their pros and their cons, and I believe that there's a place for both of them, and I think there's pros and cons and an advantage, with no pun intended, for both of them. However, we have seen a trend in the last couple of years that has really looked, for all intents and purposes, it's looked like they are dramatically incentivizing Medicare Advantage enrollment, and they're dramatically beginning to punish people that go the Medicare Supplement route. Let me explain. If you are new to the show and if you're not aware of the differences between Medicare Advantage and Medicare Supplement, we have so many episodes on this platform explaining the differences on the two. So I'm not going to go really deep into the weeds today on that. I will briefly. Medicare Supplement is when you have original Medicare as your primary. Medicare Parts A and B as your primary. Medicare A and B, original Medicare, cover medical charges, medical coverages. Hospital bills, doctor's appointments, medical charges. And there's always somebody that's going to be listening to this and they're going to be like, well, Christian didn't go all in on what Medicare covers. Listen to the show. This is episode 276. There are so many, countless episodes that we go really into the weeds on this. So I'm not going to do it today. That's not what we're going to be talking about today on this episode. But I'll give you the basics. So Original Medicare is your primary. Original Medicare, the best way to think of it is it works like two pieces of a puzzle that fit together to give you medical coverage, okay? It doesn't cover all of your medical coverage. It covers about 80% in most cases. Leaves behind 20% along with some deductibles and things like that. Original Medicare doesn't cover prescription drugs or dental. So one way you can go about structuring your Medicare is you can pick up a Medicare supplement plan through an insurance company, also known as a Medigap. It's a secondary. It fills in the holes on the medical coverage. It pays the 20% that Medicare leaves behind. And you're double covered, and you're very close to full medical coverage in most cases. When you go that way, you have to pick up a separate prescription drug plan because the supplement only pays for what Medicare pays for. Think about it like this. It's a copycat insurance. So if Medicare covers it, the supplement will cover it. If Medicare doesn't cover, the supplement won't cover either. Got it? Pretty easy, right? It's not very complicated when you look at it that way. But since Medicare doesn't cover prescription drugs, since Medicare doesn't cover dental, vision, hearing, neither will your Medicare supplement plan. Okay? So you have to pick up a separate plan for prescriptions. They call this Medicare Part-D. D for drugs is an easy way to think about it. They're individual prescription plans. You pick them up through insurance companies. And historically, they've been $5 to $10 a month, 15, 20, 30, 40, 50. Some even go up to as much to as $80 to $100 a month. And it depends on what your needs are and what your preferences are. But typically, for the majority of folks, you could get a Part D prescription drug plan for $10, $15, $20 a month, unless you're taking an abundance of medications, which certainly there's folks out there that do. On the other side of the coin, you have Medicare Advantage. Long story short, your Medicare is administered through an insurance company. They get funded by the government in order to take on your responsibility for claims. So Medicare doesn't pay that 80% anymore. And you have everything included: medical, prescription drugs, dental, vision, hearing. And they get a lot of funding, ladies and gentlemen. They get quite a bit of funding from the government in order to administer these Medicare Advantage benefits. So what's the difference between the two? Advantage, you pay very low premiums because of the funding. In a lot of cases, usually you're going to be looking at a $0 monthly premium. Some do have a premium, depends on your area. And you have copays in most cases. Not deductibles, not huge out-of-pockets. People always overemphasize really the true out-of-pocket of Medicare Advantage. Point blank, they're good plans. Point blank, the medical coverages, if I compared my own medical coverage today to some of the worst Medicare Advantage plans that I have personally seen, and then you put them into a hat at random, and I randomly stuck my hand in and I pulled one out, probably be better than my health insurance. So you're not looking at a conversation of bad and good when you're having the Medicare Advantage versus Medicare supplement conversation. It's more of a conversation of good or better. Good or better, ladies and gentlemen. Neither are bad plans, no matter what certain individuals in this industry try to tell you. There's always people that are biased towards one way or the other. Medicare supplement's the devil. Too expensive. Medicare Advantage is the devil. Copays. Prior authorizations. All insurance companies of all different types of health insurance have prior authorizations. Hate to break it to you, your work insurance has had prior authorizations. The Marketplace or Affordable Care Act plan that you've been on has had prior authorizations. And all a prior authorization is an insurance company wanting to verify that it's medically necessary. 99% of the time, and we work with claims in our office on an abundant scale. 99% of the time, and I'm not exaggerating, it might even be higher than that, 99.9. When there's a prior authorization problem with an insurance company, the provider won't send in the information that the insurance company is asking for. And if they're not sure what that is, they don't pick up the phone and call them. Their left hand's not talking to the right. That's 99% of prior authorization issues that come across my desk that we see in our office internally. And we work with thousands of Medicare Advantage members. Thousands across the country. We're licensed in over 40 states. Why do I say all this? to just give you an idea of the difference between Medicare Advantage and Medicare Supplement. Medicare Supplement, you pay a higher premium, you don't have copays. But you have to pick up multiple different plans to cover you in every different area of your coverage, right? What are we seeing that's making Medicare Supplement more challenging to be on as we go? I think it's still a great plan. But as many of you know, and if you listen to the show for some time, we did an episode, I believe, let's see, which episode was it? 270. Episode 270. Last year on the Inflation Reduction Act. Okay? So we did an episode explaining what the Inflation Reduction Act is, how it's going to impact Medicare beneficiaries, and it's essentially, mostly on the Medicare side, going to impact folks on prescription drug coverage. There's several things in there. I'm not going to kind of regurgitate everything, but the biggest thing that probably got the most headlines was starting in 2025, Medicare was going to make it a mandatory requirement that insurance companies that provide prescription drug coverage, whether it be through a Medicare Advantage plan or whether it be through an individual prescription drug plan that you get that pairs with a Medicare supplement plan, would require a mandatory $2,000 a year maximum out-of-pocket limit, a cap, which previously Medicare prescription drug coverage has never had a maximum to what you can be responsible for. So it sounds good, right? Everybody was jumping up and down for joy and excited. But if you don't think there will be a domino effect, you got another thing coming. We're already seeing it. Now, let's dissect this a little bit. If someone gets their prescription drug coverage through a Medicare supplement company, there is the premium that the person pays. $5, $10, $15, $20, $25, $30, $40, $50, $60, $70 a month in premium. There is a small amount of funding that the Centers for Medicare and Medicaid Services provide to the prescription drug plan company. Small, and I mean small. Medicare Advantage plans get funding as we have established on the other side of the coin if you get your prescription drug coverage through a Medicare Advantage plan, but they get about $1,000 a month or more in some cases in funding per member. They're getting a lot of funding. So what happens when the government makes a $2,000 mandatory maximum out-of-pocket change, and one side of the coin gets a lot of funding on the Advantage side, and the other side of the coin on the Medicare supplement side with individual prescription drug plans get a little bit of funding? Well, one is going to have a much easier time affording it than the other, right? Think this through, ladies and gentlemen. Think this through, folks. So what happens? We see a domino effect. We've already seen it. There will be companies going into 2024, we speculate, we don't know 100% for sure, but we'll probably see the individual prescription drug plans. Now, again, this is just speculation. I don't know for sure what it's going to look like in 2025. But that's when this $2,000 maximum out-of-pocket cap limit kicks in. It would not surprise me in the slightest if individual prescription drug plans saw the premiums just jump, go high. So instead of being able to get a $10, $15, $20 a month prescription drug plan, which is normal, if you take a couple generics and you just want a Medicare supplement, that's probably where you want to go. Probably don't need a $50, $60, $70 a month plan. Maybe you just need a $10 a month plan. But those $10 a month plans might not exist anymore at that point in time. You might see the premium spike on individual prescription drug plans. What else might you see? The coverage might reduce. The coverage might degenerate. And you might see higher coinsurance amounts. You might see higher copayment amounts for expensive prescriptions, brand names. So anybody that's taking a large amount of prescriptions, the likelihood that you'll be able to reach your $2,000 max out-of-pocket limit, it might make it to where, this is the best way I can explain it, I believe it's going to help a few people. It's a good thing for a few people. There are people in this country on Medicare prescription drug coverage, no matter which way you go, that's paying $5,000, $6,000, $7,000 out of pocket a year in prescription drug costs because the system has been so just broken. Pharmaceutical companies, greed, very expensive medications they charge for some of these brand name medications. the Medicare system having the donut hole and the coverage gap. If you're not familiar with what that is, go back and listen to episode 272 we did most recently explaining what the donut hole is. Go into the weeds on that. But what we're seeing is Medicare Advantage plans are going to most likely be able to weather the storm of the extra cost they're going to have to put out by having a $2,000 maximum out-of-pocket limit than individual prescription drug plans will. I just think that's realistic. In addition to that, what you're probably going to find is the out-of-pocket will likely be more for individual prescription drug plans. The premiums will be more for individual prescription drug plans. So people that were paying $800 out a year in drug costs or $1,500 a year in drug costs that never were even spending $2,000 in a year on prescription drug costs, now all of a sudden they're going to be because the coverage won't be as good. So where they're trying to get you on the Medicare supplement side is that through this Inflation Reduction Act. Everybody is jumping up and down for joy. Hooray! Maximum out of pocket. Woo-hoo-hoo-hoo! It's killing the Medicare supplement. In the next 3 to 5 years, there's a great possibility that Medicare supplement might be unbuyable, folks. Unbuyable. So for any of you out there that are on Medicare supplements that are Medicare supplement fans, and I'm sure there's plenty of you, you might, and I'm not saying you have to just jump off your Medicare supplement plan today, but there might come a day where you have to. Your prescription costs might be so much less going the Advantage route than being on a Medicare supplement plan. As I mentioned, I believe it will help a few people that that have a lot of prescription drugs they're taking on a regular basis. I think for the majority, it's going to hurt. It's going to raise everybody else's prescription drug costs. And that's what people aren't talking about. That's what people don't know. That's what people don't realize. They're looking forward to a $2,000 maximum out of pocket when a lot of people aren't even spending that now. And with the new restructure of the coverage, there's a very good possibility that you might end up hitting the $2,000 max out of pocket when you never came close before in the old structure. Now, is it good for the individual that's taking a lot of prescriptions, that's spending $5,000 or $6,000 a year? Yeah, it's great for that person. Great. But it's bad for the majority. And that's what we need to be talking about right now. It's something that I don't like to see. Again, as I mentioned at the beginning of this show, I am not a biased party. I do not favor Medicare supplement over Medicare Advantage. There's so many people out there that you can listen to that is going to push you one way or the other. They're going to demonize the other side. They're both great options. And depending on your needs and your preferences is going to determine which one is going to be better for you. And if you're listening to anybody online or you're consulting with anybody that tries to demonize the other side, they don't have your best interest in mind. They have a bias. It could be commission. Could be it's easier for them to deal with a certain type of product. They're thinking about them. They're not thinking about you, I promise. So we've never been that group. We've never been that organization. We are fair and balanced. Fair and balanced. And because of that, it makes me sad to see where I think things probably eventually will go in the Medicare supplement world. I think it's a very strong possibility that the prescription drug coverage makes the Medicare supplement product very, very difficult to have. Very difficult to have. Especially if you're taking any extensive amount of prescriptions. Now, let's say you're not taking any prescriptions. What if the lowest premium is $50, $60 a month and you're taking no prescriptions? Can you justify that? I couldn't. When you can go to a Medicare Advantage plan, pay a $0 monthly premium, and your drug coverage is built in, it's making the value proposition so much greater on the Medicare Advantage side for a lot of people in a lot of areas in the country, and making it incredibly difficult for the Medicare supplement folks to justify what they're paying for it. Medicare supplements go up in price every year. Prescription drug plans become unaffordable. Your drug costs go up. most people on Medicare are living off Social Security, retirement. They can't afford this squeeze. And in my opinion, of course, I'm speculative more than anything else. I'm not saying I have any inside knowledge, but I'm just looking at trends, I'm looking at habits, and I'm looking at what I believe the actions of these policies are. Politicians are incredibly good. I think most of us can agree with this. Politicians are incredibly good at making something look one way, making something look like it's a savior, when in reality, it's a huge bill that will hurt more people than it will help. That is politics as far as I'm concerned, ladies and gentlemen. And this Inflation Reduction Act, at least on the Medicare portions of it, is that, in my opinion. Anyway, folks, it's so good to be back with you. We're going to be trying to bring you episodes much more consistently going forward into the annual election period. What do you need to know about the annual election period? Well, if you're on a Medicare Advantage plan, you will be receiving an annual notice of change on your plan, most likely the end of September, if not the beginning of October, depending on your mail system. That will tell you exactly what is changing on your plan from this year to next year. It'll tell you if your plan's getting better, worse, staying the same. I would expect most of you to start getting bombarded with advertising, commercials, phone calls, mailers, probably in September. So understand, if you're on Medicare, every single fall during open enrollment, you are going to get inundated. And that is probably a truth for the rest of your life once you get on Medicare during this time of the year. It's gonna be everywhere, every single place that you look. I can't talk too much about specific changes. We're too early for that. But as soon as I'm able to, October 1st is the first day I'm actually able to tell you about specific changes for 2024. I will be making episodes and delivering them out to you, me and my organization. If you're on Medicare or you're about to be on Medicare and you need help, as I mentioned, we're licensed in over 40 states. We can help you in a myriad of different places. We are specialized. We're the best of the best as far as I'm concerned. Of course, I'm a biased party, but I think we're damn good. We have great long-term customer service. We have a perfect 5-star review online. If you'd like to work with us on your plan, reach out to my office. There's no obligation. And even if you just wanted to ask some questions, you can talk with one of our licensed agents. That number is 801-255-5340. Again, 801-255-5340. Christian Brindle Insurance Services. And folks, I was so happy to be back with you. It's been far too long since I brought you an episode and you were able to hear my voice, so I apologize about that. But expect more episodes as we go. All right, folks, thanks so much for listening. We appreciate you, and we'll see you next time.